Where is your question? Right, so if you have read and understood, considering it clinical examination station, kindly begin.
Okay, I will enter the bell. I'll wash my hands. I'm Dr. Oluwasegun. Good evening, ma'am. Can I know your name and confirm your name and age, please?
I'm Gunilla, 62 years old.
Okay, good evening, Kunila. This evening, I would like to examine you. It involves me examining your neck. It involves me looking, touching, and asking you to do some tests, and then involving other, looking and moving other parts of your body. Is it okay by you?
Yes.
Okay, kindly sit down and make yourself comfortably. I would like you to remove the first two buttons of your
Gown. Okay.
gown, and then
Yes.
also remove the edge gear that you're putting on. Thank you for doing that.
Okay.
Okay, so I'll start. I want to show me your hand, so I'll check. I'm checking your hand to see for if there is any problem with your nail. I'll also turn it up. Let me look at your palm. So I'm going to touch your palm. I want to see if it is wet and then also warm. So thank you. Okay, can you spread your hands together? Put both of them together. Then I'm going to put a paper. I want to check if you're having tremor in your hand. Okay, thank you. Then I want to look at your eyes. So just look at my hand. Don't move your head. Just only move your eyeballs and follow my hand. So I'm just making each. So just follow. If you have pain while doing this, let me know. Or if you have you are seeing double vision while following my hand, kindly let me know. Is that okay? Thank you for doing this. Okay. All right. So fine. No problem. So I'm going to examine your eye also from the side. So I'm going to stand up, come to your right side. I'm going to look at your eye and see if it's becoming bigger. I'm just looking to see if your eye is protruding out. So I'm also going, is it okay by me coming out for me to examine you from the back?
Okay, yes.
So I'm going to go to your back. Can you please look at the ceiling a bit? So I'm also looking, your eye is coming back, then it's protruding out. Okay, thank you. You can put your head back very well. Then I'm also going to examine your eyes on the other side. Okay, thank you. So I'm going to come back and sit in front again. So thank you. I'll look at your neck now. I want to see if there's any abnormality apart from the swelling, if there is skin changes, there's any discharge or color discoloration or scar. Those are the things I'm checking for in your neck. Thank you. Okay. I want you to open your mouth. Thank you. So I'm just looking, I'll shine light. I just want to see if there's any abnormality in your mouth. Okay, thank you. Can you bring out your tongue? So I want to see the tongue, as you bring out your tongue, whether the mass also moves. Okay, thank you. Then take this water, take a sip. All right, thank you. Then I'll ask you to swallow it. Okay, swallow now. Okay, all right, thank you. So I'm going to examine you from the back. Omela, I hope it's okay by you.
Yes.
Okay, so I'm going to go to your back. Okay, so I'm going to check for if the mass is pale. Is it any pain on your neck now?
No.
Okay, all right. So I'm going to check and see if there's any pain. Okay, I'm going to check both right, put the leg towards the right and check on the right, and then do the palpate for if it's tender, then also palpate for differential warmth. Also, I'm going to palpate your trachea. So I want to check your trachea now if it is at the normal place or that's shifted by the mass. Okay, so that's fine. Then I'm going to check the mass to check for the consistency, whether the skin over it is attached or not, and whether it's mobile, then the edges, if it is smooth or irregular in shape. So okay, so I've done all those ones. So I want to listen to I want to put my hand and listen to the structure now. So kindly breathe in and don't breathe out again. So I'll put my state and auscultate on both sides. Okay, fine. So you can continue to breathe in very well again. Thank you. Then I'm also going to put my hand and check for the carotid pulse one side at a time. Okay, I'm just checking for your pulse. Okay, then check on
Okay.
the other side. Then I'm going to come to the front to check for the pulse. Sorry, to check for the reflexes for the biceps and then the triceps reflex, and then also check for the tone. And then also I'm checking your hand now for can you put both your hands on your shoulder and try to stand up? Okay, that's fine. Then I'm going to go to your feet now. I want to look at something at your foot. So I'm going to, can you pull your gun up to your just above your knee?
Yes.
Okay, thank you. So I'm just going to rub my hand and feel the knee and the front of your chin, and then also see if there's any swelling. Okay, so that's fine. Then I'll ask you, can you stand up and make 1 or 2 steps to walk for me? Okay, come back. So I think those are the things. Thank you. Then I'll wash my hands and put on your button back. Or do you want me to assist you? Thank you. Then I'll wash my hands.
Okay. Right. How would you complete your examination?
Yes. Pardon?
How would you have completed your examination?
Okay, okay, yes, then I will check the only thing, sorry, I forgot to check. I'll check for retrosternal extension. So I'll go back
Yes.
to your today and then check for the retrosternal extension across from the lower part of the sternum up towards the manubrium and see if there's any change in dullness.
Good. Okay, now you can summarize your examination, please.
So I've examined a 62-year-old woman that presented with an anterior neck swelling. There is no change in the overlying skin. Is not tender and no differential warmth. The swelling is nodular and firm,
Yes.
and
How
not
big?
attached to. The swelling is about 10 by 5 centimeter
Okay.
in dimension. Not
Overlying
attached to
skin is?
overlying skin is no changes to overlying skin, and it's not attached to the overlying skin, and it's mobile. Is firm in nature and has regular edges. Then there
Yes.
is no features of hyperthyroidism or hypothyroidism in the patient.
Right. What are
Then
your
no,
provisional and differential diagnosis that you'll consider?
so my provisional diagnosis is simple multinodular goiter. Also, I'm also considering a thyroid tumor, and then also to rule out a toxic multinodular goiter.
Yes. What are the investigations that you'll ask for to confirm your diagnosis?
Okay, I want to do a neck ultrasound.
Yes.
Then I want
First,
to do thyroid.
have you heard of triple assessment? Begin with triple assessment, please.
Yes, I'll do a triple assessment. I also
Yes.
want to take history and then do a neck ultrasound and then
Yes.
request for
Okay.
fine needle aspiration, cytology of the neck mass to rule out any malignancy.
Okay. What are the treatment alternatives or options that you can offer this patient?
Yes, the treatment option is for simple multinodular goiter, patients can benefit from either a subtotal or near total thyroidectomy. But if it is patient is toxic, I'll first want to make patient with thyroid by giving patient medications, propanolol, propyltyrosine, and then to make patients with thyroid, and then after I can either over the patient surgery also. Then the other option, if patient is toxic, is also use of radioactive iodine therapy.
Okay, good. Thank you. Right.